Hi, I'm Maddie. I'm going to perform hand hygiene. I'm going to be your student nurse today, privacy. So I'm just going to ask you for your name and date of birth, please. I'm going to check the bracelet. That matches up. So before we get started, can I just have verbal consent for this exam to be recorded? Great. So before we get started, is there any shortness of breath, any trouble breathing? No. Okay. So I'm gonna inspect and look at the breathing efforts before I do anything. I'm looking at accessory muscle use, tripoding, retractions, depth pattern. So I see effortless, regular breathing patterns, no retractions, no accessory muscles or tripoding. So I'm just gonna look at the respiratory rate. I'm gonna pretend to take his heart rate, his pulse, and I'm going to be looking for his breathing patterns. And I'm going to count to 15 seconds and multiply that by 4. So I got 16 for the respiratory rate. So now I'm just going to have you turn around, please. I'm going to inspect the posterior thorax. So lifting up the shirt. I'm going to inspect the skin. So the color matches the ethnicity. I see no lesions present. And I'm just going to look at your AP ratio, please. So if you could just turn to the side and turn to the back. So the AP ratio is 1 to 2. And I'm just observing, and I see an equal rise and fall of the scapula. So I'm going to now palpate the posterior thorax. So I'm just looking for tenderness or masses. I'm going to go at the cervical spine, the thoracic spine, the scapula, ribs, and intercostal spaces. So I felt no tenderness or masses. Now I'm going to look for symmetric expansion. So I'm going to grab both sides right here, pinch a little bit, and see how my hands rise and fall. So I see positive symmetric expansion. Okay, now I'm going to place my hands in 4 spots, and I'm going to have you say 99, 99, 99. 99, 99. So the tactile firmness is equal bilaterally. Now I'm going to percuss the posterior thorax in the 10 spots. I'm avoiding bony prominences, areas in the scapula and spine. So 1, 2. So I heard resonance in all lung fields. Now I'm going to auscultate the lung sounds. So I'm listening over the first and second intercostal spaces for bronchovesicular breath sounds under the shirt. So I hear clear bronchovesicular breath sounds over the first and second intercostal spaces. And now I'm going to listen to the vesicular breath sounds in the 10 spots. So I hear clear vesicular sounds in the major lung fields. And I heard clear bronchovesicular breath sounds over the first and second intercostal spaces. So now I'm going to palpate the anterior thorax. So my guys already turned around. Thank you for turning around for me. So I'm going to use the palms of my hand and kind of feel for tenderness or masses in the clavicle, the sternum, the ribs, and the intercostal spaces. I feel no tenderness or masses. Now I'm going to auscultate the lung sounds. So I'm going to listen over the trachea for stridor. So I'm just going to have you take a deep breath in and out, please. So I don't hear stridor, no stridor. I'm going to listen over the first and second intercostal spaces for bronchovesicular breath sounds. So I hear clear bronchovesicular breath sounds over the first and second intercostal spaces. I'm going to listen for vesicular breath sounds in the 6 spots. And I hear clear vesicular breath sounds in the major lung fields. So now I'm going to move on to CVPV. All right. So before we get started, do you have any chest pain? Are you experiencing any dizziness? No? Okay. So I'm going to inspect the precordium. So I'm going to position you to a 90-degree angle, okay? Thank you. I'm just going to be looking for any lesions, skin color changes, pulsations, swirls, or heaves. I see the skin color matches the ethnicity. There are no skin color changes, no pulsations, thrills, or heaves. Not feeling, I'm just looking. Now I'm going to palpate the precordium. So I'm just going to have you lean forward, please, and I'm going to feel at the 5th intercostal space, mid-clavicular line. I'm going to look and see, I'm going to feel for the apical pulse. So it is located, +2. Now I'm going to position you to a recumbent position, so that's 30 degrees with your legs supported. I'm just going to inspect the precordium while in this position. So I see the skin color matches the ethnicity. There are no color changes, no pulsations, thrills, or heaves. So now I'm going to palpate the precordium. I'm just going to use the palm of my hand to try and feel. So no pulsations, thrills, or heaves, or pain upon palpation. Now I'm going to inspect for JVD, jugular venous distension. So I'm going to have you look to the left while I look at the right side of your neck for bulging jugular veins. So I don't see any JVD. Now I'm going to palpate the carotid arteries. So I'm going to feel for them. I'm going to feel the left side, and I'm going to feel the right side, doing one at a time. So +2 bilaterally, carotid arteries. Now I'm going to auscultate the carotid arteries. So using the bell of my stethoscope, I'm going to ask my patient to hold his breath while we listen for bruits bilaterally using my bell. Negative bruits bilaterally. Now I'm going to auscultate the heart sounds. So using the diaphragm of my stethoscope, I'm going to locate all 5 heart sounds for 4 cardiac cycles, listening for the S1 and S2. So at the aortic, the right sternal border, 2nd intercostal space. The pulmonic, the left sternal border, 2nd intercostal space. Erb's point, the left sternal border, 3rd intercostal space. Tricuspid, left sternal border, 4th intercostal space. And the mitral, the left mid-clavicular line, 5th intercostal space. So regular rate and rhythm in all 5 heart sounds with S1 and S2 for 4 cardiac cycles. Now I'm going to check for bruits in the same heart sounds, and I'm going to use the 4 cardiac cycles as well. So again, the aortic, the right sternal border, 2nd intercostal space. Pulmonic, left sternal border, 2nd intercostal space. Erb's point, left sternal border, 3rd intercostal space. Tricuspid, left sternal border, 4th intercostal space. And the mitral, the left mid-clavicular, 5th intercostal space. So negative bruits in all 5 heart sounds. I listen to 4 cardiac cycles. So now I'm going to inspect the upper extremity skin. I'm just looking for asymmetry, skin color changes, lesions, edema. No asymmetry. Skin color matches the ethnicity, no lesions or edema. So I'm going to palpate the upper extremities using the back dorsal aspect of my hand from the shoulder to the fingertips, feeling for texture, temperature, and moisture. So the skin is warm, dry, and intact. Next, I'm going to check the cap refills of the fingers for all 10 fingers. And the cap refill was less than 2 seconds. Now I'm going to assess the pulses, and I'm going to grade them. So the brachial, the ulnar, and the radial. So I felt +2 upper extremity pulses for all the upper extremity pulses. And I'm going to count the heart rate. So I'm going to feel the radial pulse, count to 30 seconds, and multiply that by 2. All right, so I got the heart rate, 74. I'm going to now inspect the lower extremity skin. I'm assessing for asymmetry, skin color changes, lesions, edemas, open areas, hair distribution. So I find no asymmetry, the skin color matches the ethnicity, no lesions or edema. No open areas, and symmetric hair. So now I'm going to be palpating the lower extremities using the back dorsal aspect of my hand from hips to toes for temperature, texture, and moisture. I feel the skin is cool, dry, and intact. Next, I'm going to do cap refill in all 10 toes. Each toe, all the toes were less than 2 seconds for cap refill. Next, I'm going to feel and assess the pulses and grades of the femoral, popliteal, dorsalis pedis, and posterior tibialis. So, +2 for all lower extremity pulses bilaterally. Thank you.